Hi doctors, welcome back to our portfolio building series. Today we're diving into clinical audit and QIP, quality improvement projects, and how these essential activities can take your UK NHS job application to the next level. So let's explore why these projects are such a powerful addition to your portfolio. What is clinical audit and QIP? First, let's break down what clinical audits and quality improvement projects are all about. Clinical audits are systematic reviews of clinical practices against the evidence-based standards to identify areas of improvement. Meanwhile, quality improvement projects focus on making changes to the improved patient care based on the audit findings. Both of these activities contribute directly to enhancing healthcare services, improving patient outcomes, and ensuring that hospitals maintain high standards. They also provide a great opportunity for you to show that you're not just performing your day-to-day duties, but actively contributing to the betterment of medical practice. So why should you include clinical audits and QIPs in your portfolio? Well, these projects demonstrate your ability to identify gaps in care, design, or implementation solutions and evaluate their effectiveness. This kind of work, shows recruiters that you are committed to improving healthcare standards and contributing to the medical community. Furthermore, audits and QIPs often provide opportunities for presentations at medical conferences, which can give you additional visibility and networking opportunities. Having a project that's presented at conference is a great way to earn application scoring points for your portfolio. So how do you get involved? How do you get started? To get started with clinical audits and QIP, you don't need to wait for a formal opportunity. You can propose a project within your current clinical setting, or you can collaborate with colleagues and mentors to work on the ongoing initiatives. Many healthcare institutions have regular audit cycles, so ask about any upcoming projects or join audit groups that you can find. Once you've completed a successful audit or QIP, make sure to document it thoroughly. Include the aim of the project, your role, any data collected, the changes made, and the outcomes that you have achieved. This will be valuable information to share in your portfolio. Benefits to your portfolio. Clinical audits and QIP show that you can work in teams, analyze data, and implement change, all that are valuable skills in any healthcare environment. Including these projects in your portfolio strengthens your credibility as a proactive, engaged doctor who can make a real impact in the NHS. Clinical audits and QIP are essential components of a standout portfolio. If you're ready to start documenting and presenting your audit work, or if you want guidance on how to showcase your achievements, our Portfolio Plus program can help. To learn more about our Portfolio Plus program, fill the link in description and we will get in touch. Thank you for watching and stay tuned for our next video that is going to be on oral and e-poster presentation. Bye.